Hello everyone, this is Dr. Zina speaking. Today I will be speaking about how to give lower incisors infiltration. So the correct technique for giving anesthesia for the lower incisors, both buccally and lingually. Lower incisor infiltration is a dental injection technique where a local anesthetic is injected into the gum tissue to numb the lower front teeth, the lower incisors. Both the central and lateral incisors, together with the canine, all will be anesthetized by the lower incisor infiltration. And it is often done by administering both a buccal, which is the cheek side, and the lingual, that is the tongue side injection for better success. This method is effective for superficial procedures like treating decay or minor extractions, but the anesthetic is often a supplement to a larger block injection. The usual anesthetic agent is articaine. 4% with epinephrine is often recommended as a more effective solution for this area compared to lidocaine. Now for the way how to give the lower incisor infiltration, starting from the buccal or the labial side. What you will do, you need to retract the lips of the patient completely. Once you retract it completely, you will see a depression that you can see in the picture down below. This depression is just below the lower incisors, particularly the teeth that you're working on. If you're working on the lower central, then you will give it just below the lower central incisor on the depression at a 45-degree angulation. You will insert your needle. Once you insert, you need to keep inserting the needle until you feel the bone. Once you feel the bone, then just give the local anesthetic agent. So if you are working on the canine, you need to give it on the canine tooth, right? On the canine side, which means that once you retract the lips completely, you will give it on the depression that is just below the canine at 45-degree angulation. Now for the lingual side, the lingual infiltration is performed in the reflected mucosa in the apical region of the tooth of interest. So if you are working on the central incisors, the apical region, which means that lingually you go down around 5 millimeters and then you will give your injection. Doesn't matter whether you are going 45, 90 degree, because obviously the point of insertion depends on how you will insert your syringe or your needle into the mucosa.